Chronic health conditions, we also asked about skin conditions because this is what we do see frequently in hospital as well. The experience of bed bug bites, 59%, head lice, body lice, scabies, 7% in the last year. Problems with their feet, 24%. Dental problems, very prominent, and often an unmet need of care. So this is a somewhat complex slide, and I'll try to walk you through it, but on the drugs are listed there, and across the top are the number of people we recruited in each city, so in Vancouver, Toronto, and Ottawa. And what I wanted to highlight in blue are, in general in Vancouver, the prevalence of self-reported drug use is higher, particularly for cocaine, heroin, and speedballs. Relative to the other cities. Although Vancouver has a reputation of being the marijuana capital, marijuana is used everywhere. I just wanted to point that out, that Ottawa reports using more marijuana than us. So it's a myth. So at 1 year follow-up, I just wanted to show you we lost about 19% we couldn't find. And we were able to locate about 969 people, so 81%. And we started out with 396 in Vancouver. We were able to find 310. 76 were lost to follow-up. 5 refused to be interviewed again, and 5 people, unfortunately, died. 5 people died in Toronto, and 7 people at year 1 have died in Ottawa. And again, I just want to highlight, remember how young these people are. So it kind of hits home when Stephen Wong presented about life expectancy. They're real numbers. It's really happening, as you know, with all the people you've been caring for. So this slide also has a lot of information, and what it shows is the housing transitions. So H is homeless, CH means conventionally housed, meaning that people moved into an apartment. VH is they remain vulnerably housed in an SRO or a rooming house, and I means institutional, maybe they're in an addiction treatment center or they're incarcerated. So at the top, it shows the housing transitions for the homeless people for the 3 cities. And what I wanted to highlight is that 46% of people in Vancouver changed their residence, 55% in Toronto did, and then in Ottawa, 57% of people in that year changed their residence. I just want you to note that twice as many homeless people moved into conventional housing, the CH, in Toronto and Ottawa than in Vancouver. So most of the homeless people in Vancouver moved into vulnerably housed situations, and I think it's more of the reflection of our housing stock, and with the province buying up over, I think, about 29 hotels, and those being renovated, and so that moved a lot of our homeless people into that housing stock, whereas the way it had been working in Ottawa and Toronto, they had more market apartments that became social housing. They had just a very different housing distribution. And then also, again, among the vulnerably housed, just highlighting that more people moved into conventional housing, 27% in Toronto, 22% in Ottawa than in Vancouver. But fortunately, in Vancouver, only 4% went from vulnerably housed to homeless, where it was much higher in Toronto and Ottawa. So that's something that was interesting to observe. So I had presented this at the Canadian Housing and Renewal Association meeting in the spring, and some people from BC Housing were present, and we met with them, and so because they'd been working on all of these different housing stock and trying to renovate and improve the situation, they provided us with a list of non-market housing projects that were completed or being renovated during the study period. And so what we did is we looked at our data and tried to map out who was in where, what place, and looked at the transitions for the participants in our SRO housing. So at the beginning we had recruited 200 participants, and to date we've been able to get information and map out 149, so 75% of the original sample. So at baseline we had 84 people who were in the non-market housing SRO, so that's what NMH means, and then 65 were in the market housing SRO. So again, the 84, I just want to highlight that 43% stayed in the same non-market housing, and this is about at a year and a half, so we tried to map out as much data we have on people. Moved to different non-market SROs would be 23%. And so essentially a total of 66% of people remained in that kind of housing stock. And it was very interestingly kind of similar for the market housing, so the ones that are not run by not-for-profits. So 53% stayed in the same one, 12% moved, and again, 65% are in the same one. So it's kind of interesting because I think there are likely different kinds of people that are living in these different kinds of SROs, and that's something that we can better characterize because we have data and we actually know where they are. So I have all that information. I'm happy to share and talk to people about it, but I'm curious to hear your thoughts about that. And then looking at who, those who left, where did they go? So here, there was 84 of the people who left. A small group, 4% in the non-market, moved to the market housing. 5% became homeless. 16 moved to their own apartment. We weren't able to track 3 people, and 2 went to treatment center, and a similar proportion again in the market housing. So I think what this kind of highlights is that we need to better characterize who these people are, because I think when we present data, we're presenting the aggregate, the total, and sometimes we have to pick it apart and get the details to really understand what a phenomena is. And also map out what services are being provided at the different SROs that are being operated and where people are living. So I think the next steps in addition to that are relating these housing transitions to health status information, and then to examine the effect of housing with the health supports on the participants' outcomes and quality of life. And then people also provided information about what works for them and what doesn't work for them, and mapping that on these data as well. And also the transitions. I'm curious to know from people who are working with this population as to why you think what are some of the reasons as to why some of these transitions are occurring, and to help us unpack that more. So I'll stop, and thank you very much.